My name is Zara Arboleta, reporting live from my home, as I have been, I think, for the last, it seems like 8 years, joined by 3 wonderful doctors from our Valley Children's family who will be sharing their expertise as well as their own personal experiences with the COVID-19 vaccine. We have maternal fetal medicine specialist, Dr. Lissa Francois. Dr. Francois, thank you for joining us today. And we also have 2 of our pediatric hospitalists, Dr. Christine Santos, who is 15 weeks pregnant, going into the wonderful and fun second trimester of her pregnancy, as well as a hospitalist, Dr. Jaimie Brandley as well, who is the mom of a 4-month-old, and she is also currently nursing her baby. So thank you, ladies, all of you for joining us today. A lot of questions have been coming in through Facebook and Instagram and Twitter. And for those of you who are watching, please continue to leave your questions or comments in the comment section, and we'll make sure to get to all of your questions today. But we're going to start off first with Dr. Francois, who is going to give us a bit of background on the COVID-19 vaccine itself. And you are muted. Let's get you unmuted.
There you go.
There you go. Hi.
Here I am speaking, thinking everyone can hear me. All right. I'm not in charge of the slides, am I? Can I forward myself?
So Megan's got them. So Megan is running it, and just let her know when you want to advance.
Okay, perfectly. So once again, my name is Dr. Lissa Francois. I am a maternal fetal medicine specialist here at Valley Children Healthcare. And today's presentation will be regarding the vaccine, COVID vaccine in pregnancy as regards to lactation as well as fertility. So we're going to just start with the basics of how does this mRNA vaccine work. So as you guys know, that this is a new novel technology that has not been used prior in previous vaccines. But just my little picture here that I created. Essentially the genetic material, I don't know if you can see my pointer, probably not, but the genetic material is in my drawing of what I consider a syringe. As best I can, as Megan can point to that. And inside the syringe is the little mRNA, which is the mRNA for the SARS-CoV-2. That is then injected into your muscle cell, which is the next circular diagram to the right. And once that mRNA is injected into the muscle cell, these ribosomes, which are in red, Megan, the red, starts to transcribe the spike protein, which are this bright yellow that are there. Those bright yellows are then brought to the surface of the cell, and they're sitting there. And then the Y are the antibodies that are formed against those spike cells. And those antibodies are what is used to fight against the COVID-19 infection. As you can see from the diagram, the nucleus, which is that blue circle with a big N, the mRNA never enters it. So what does that mean? It means that the mRNA does not integrate into the cell DNA, and it never enters the nucleus. So therefore, everything is happening outside the nucleus, so it's deemed relatively safe. Given the fact that the mRNA comes in, it is rapidly degraded, that the likelihood that it will cross into and reach and cross into the placenta is very low. Next slide. So what do we know about mRNA vaccines in pregnancy in general? So there were pregnant individuals that were inadvertently enrolled in the clinical trials. There were 23 pregnancies in the Pfizer trial, 12 actually in vaccine arm. And then there was 13 pregnancies in the Mrna trial, 6 in the vaccine arm. Of those pregnancies, thus far, no adverse effects have been reported by these individuals. Furthermore, there's animal studies on reproductive toxicology, which did not demonstrate adverse effects. And what does that translate to is that typically animal models are used to verify the potential adverse effects or exposures that particular medication, or in this instance, vaccines, were made to future, let's say, rats, pups, and we saw that there were none. And so based on those animal studies, the toxicology reports that there's probably no adverse effects associated with the vaccination in pregnancy. Next slide. However, to discuss the balance is what are the benefits of getting the vaccine? So we know that pregnancy is a risk factor for severe illness, and pregnancy in of itself is an independent risk factor for the severity of illness that we see in patients who are pregnant versus in those who are non-pregnant. We know that pregnant women are more likely to end up in the ICU. Pregnant women are more likely to end up on a ventilator, and pregnant women are more likely to die from the COVID-19 infection. And additionally, there appears to be an increased risk of preterm birth as well as cesarean delivery. And although, just for a caveat, 90% of women actually end up continuing their gestation and not being delivered, those with severe illnesses are the ones who end up with preterm birth and typically via cesarean delivery. And there's sequelae, as we all know, to prematurity and the associated risk of prematurity. Next slide. So what are the risks for getting the COVID-19 vaccine? So we discussed the benefits of getting it. And so the risk is this. Essentially, there's just a lack of data. And everyone's afraid when they're and fearful when the information is not available and the answer is unknown. And essentially right now we're in the unknown kind of vacuum. Although there's a lack of data and we really don't know what the COVID-19 vaccine pregnancy can do, we know thus far there's an absence of data demonstrating adverse effect of the vaccine in pregnancy. So half full, half empty glass, which one do you take? Do you take the fact that there is a lack of data in terms of the risk with the vaccine in pregnancy, or the fact that thus far we have not seen any adverse effects in the pregnancies? The most common side effects are the ones that we typically see, which are fatigue, fever, headaches, muscle pain, chills, injection site reaction, just that soreness of the arm or redness, and joint pain. Next slide. We'll now discuss what the experts recommend. And when you read the societal recommendations, they read very confusing. They're in the sense that they neither say yes or no, but strongly recommend that you do without saying they strongly recommend that you do. And so wording becomes really important, okay? So I chose to just pick out the exact wording that our society had recommended just to make sure that I am conveying thus far what the society that kind of gives us our guidelines are saying in terms of their statement to the public. So currently, because there's a lack of data on the safety of the COVID-19 vaccine, there are no clear recommendations. Pregnant patients are excluded or were excluded from the trials, but further studies are ongoing and safety data will be available soon, hopefully. In the meantime, what we recommend is that there should be a shared decision between you and your healthcare provider. And essentially, you want to discuss the available data on the vaccine safety when it comes as it related to fetal risk, as it related to the risk of infection acquisition. So what happens if yourself gets COVID-19, individual risk for severity of disease. So there are pregnant patients I've taken care of who've had COVID, who didn't know, came into the hospital completely asymptomatic. We did a swab and there she's positive and she had no idea. And then there are other individuals who come in who have multiple risk factors. They're diabetics, poorly controlled. They have immune compromise. They're immune compromised with some sort of illness. And so their individual risk for severity of disease is a lot higher than the one who came in for a routine evaluation should just found to have a positive test. And as well as something also to consider is the level of COVID-19 transmission in your community. They know where we're located, right, Zara? That we're in California, and our transmission rate has steadily increased to the point where we have surpassed New York State, and New York State was the hotspot, and now California has now become the new hotspot. So it's really important to be able to assess the level of community transmission to determine your risk, and that should be, once again, a shared decision between you and your healthcare provider. You also want to make sure that if you are at higher risk, and who are people who are at higher risk? Once again, those that have underlying compromise, chronic medical comorbidities, as well as frontline workers. And those frontline workers vary in terms of their actual profession. So if you are any of that subpopulation, then it probably makes a lot of sense for you to get the vaccine. Here is the societal recommendations or societal statements. The Society for Maternal Fetal Medicine strongly recommends that pregnant individuals have access to COVID-19 vaccine and be able to obtain it if they so desire. The American College of Obstetricians and Gynecologists recommend that the vaccine should not be withheld from pregnant individuals who meet criteria for vaccination. And overall, the risk of getting the vaccine during pregnancy are thought to be small. That was a chock full of information, one little slide, but I thought it was really important to state exactly the recommendations or the statement from the two different societies. So you can make a very informed decision regarding vaccination. I'm sorry. Next slide. So what are the effects on reproductive health and lactation? So we know that breast milk does not contain the virus, rather the antibodies that the mother made against the virus, which should offer the baby some protection. Society of Maternal Fetal Medicine reports that there is no reason to believe that the vaccine affects the safety of breast milk. Available data indicates that the vaccine does not cause infertility in men or women. And according to the American Society for Reproductive Medicine, they actually have the strongest recommendations I have seen. They recommend vaccine for women who are contemplating pregnancy or who are pregnant to reduce their risk, to reduce risk to their pregnancy. I believe that's it. Next slide. That's it. All right, so that was just the vaccine information 101. And Zara, I'll turn it over to you to continue with this forum.
Thank you, Dr. Francois. And again, for those of you just tuning in, please remember to leave your comments and questions in the comment section here on Facebook, and we will get to them. Although, Dr. Francois, that was a great, very informative presentation that I think answered maybe 80% of the questions that have been coming in. Right now, though, I think it's important for people at home to note that vaccine hesitancy is real and that it's understandable why people would be questioning and have lots of questions about this vaccine. But at Valley Children's, among our medical staff, more than 95% of our doctors have signed up or already received their vaccine. So for me, when you all say, get it, it's safe, I believe you. So when we talked about doing this panel, we wanted to make sure that various viewpoints were represented. And so we do have Dr. Santos and Dr. Brandley here. So why don't we start with you, Dr. Santos? Hope you're feeling okay 15 weeks into your pregnancy. Why did you not only want to take part in this forum, but come to the decision you did to go ahead and get the vaccine? Because you were still in your first trimester then when you received your shot, or did you just recently get your shot?
I was just out of the first trimester, actually.
Okay.
So I'm actually feeling well. Thank you so much. Thank you for hosting this. I've been quite lucky. And I feel like I'm a fairly educated person, well-informed, but I myself had some hesitancy because of the lack of safety data. But for me, it was really kind of weighing pros and cons and then going to the literature to what we do know, because, obviously data at this point are lacking on vaccine trials in pregnant women. And hopefully more to come now that people are doing it. So I really looked at how does the vaccine work? Does that mechanism of action pose a risk to me or my baby? And I really believe that it does not. And then I think the big thing that swayed me was the risk of having COVID infection during pregnancy. You know, my number one job right now is to protect my baby and myself, and being in the ICU, being on a ventilator, dying from COVID is not going to help me achieve that goal. So I think those things really, really swayed me to go ahead and get the vaccine. And I haven't had any regrets on doing that at all. I've just had my first vaccine and I'm due for my second in about a week or two. And I feel pretty confident in that.
Thank you, Dr. Santos. Dr. Brandley, you've got a 4-month-old at home, so I'm hoping you're sleeping somewhat regularly. But for you, where are you? When did you receive your first and second doses? How long ago? And what was the catalyst for you to also say, you know what, I'm going to go ahead and do this and get my vaccine?
Yeah, so I do have a 4-month-old. She's actually sleeping great. I'm going to knock on wood here, and we're doing great. I got my vaccine about 6 weeks ago, and then the repeat a couple weeks or 3 or 4 weeks after that. And really, the number one reason that I decided to get this vaccine is for the baby. We know that antibodies travel through the breast milk, and that babies have some form of passive immunity from antibodies that we go ahead and give them. So I wanted my breastfeeding to be doing, you know, the strongest work it possibly could, and give her some protection with those antibodies. The other thing that I think is I kind of have a little bit of a unique viewpoint on is that I gave birth during a pandemic. I gave birth during a pandemic while my husband was deployed. So I know what it is to be isolated from all of these different things. And truth, I got this vaccine because I miss my village. I really do want to have, you know, the community and the joy surrounding the birth of a new baby. And it's really hard to do that if you're scared you're going to get sick or your baby's going to get sick. So I think that for me, getting that vaccine in my arm and getting to see friends and family again, getting to, you know, have that village back surrounding us was really, really important.
Yeah, thank you to all three of you doctors for joining us with your very unique perspectives. Dr. Francois, one question that came up quite often over the last week or so when we were soliciting questions from the public was, I know you addressed this somewhat, but probably more pointed answer now, more detailed. The question to sum up all of them is, how can we go ahead and recommend this vaccine for women who are pregnant or thinking of becoming pregnant, or women who are nursing, when there is such limited data and it was tested on such a small subset of women who fell into one of these buckets?
Oh, that's actually a great question. What I always tell my patients is this: there's a lot of medications that have been used in pregnancy that we've had limited data or anecdotal data on. And so similarly, we check to see what the safety profile looks like outside of pregnancy. We check to see what the animal studies have shown. And a lot of our data will then kind of bridge from that, from animal studies, as well as from studies that were done in a non-pregnant state. It is very hard to have a clinical trial, where pregnant patients will sign up readily to be administered a new innovative medication, or in this case, a vaccine. And so our numbers will always be lagging, as well as my colleagues who are pediatricians can tell you, and children, it always also will be lagging as well, because there's this great hesitancy for pregnant women or pregnant individuals to sign up for trials. However, with that stated, we know that there are certain things that we can extrapolate from other data in the non-pregnant state and use that in conjunction with animal studies, which we can study actual pregnancy. And some animal studies, placenta, are very similar to the human placenta. And so you can extrapolate a lot in terms of what actually crosses into the baby placenta via the placenta into the baby via those studies. So it's a great question. My only answer to it, there's a lot of information that we use in pregnancy that we just try to extrapolate from the non-pregnant state, as well as from animal studies, to kind of summarize and bring forth a recommendation. In this case, I think what we're balancing, in my opinion, is the balance of those who are infected with COVID and the seriousness of the illness. You don't know who's going to be severely ill. There's not a set criteria that says that person will get sick, but this person should do well. Yes, there are risk factors, and pregnancy is one of them, right? That says the likelihood of getting the illness, the severity of it is probably increased. But who is to say that Jaimie, Dr. Brandley, when she was pregnant, she would have gotten it, but Dr. Santos would not? I have no idea which of the two. And that's why, therefore, you look at that risk, and then you say, well, the benefit is this. Although we do not have enough trials and studies based on pregnancy, we know that if Dr. Brandley received it, she may end up in the ICU. Mm-hmm. Does that make sense?
Yeah, and that's the scary thing. There have been very healthy people who contracted COVID-19 who ended up in the ICU. There have been, it's just, you don't know, to your point. Dr. Brandley, this question for you, or I don't know if this should be you or Dr. Francois, it's kind of free for all, whoever can answer this. Can COVID-19 be passed to baby while breastfeeding?
So the short answer is yes, it can be. But like we've been talking about this whole time, there's benefit and risk to everything. And really our benefit is that you're going to be continuing to breastfeed. You're going to have your baby mom bonding time. So generally right now, our recommendation is not to separate mom and baby when breastfeeding, when mom is infected with COVID-19. Obviously, there are extenuating circumstances. If mom is truly very, very ill and needs to have other care, then clearly they need to be separated. But the actual, when mom actually has COVID-19, she should continue to breastfeed as long as that is possible.
Right. And just to add to that point, remember that the breast milk does not contain the protein of COVID. It doesn't contain the SARS protein. What it contains is the antibody that the mother has created against the COVID-19 infection. And so, yes, there's a few studies, and just because it's out there, you'll see a few case reports of placenta implantation of COVID and neonates who tested positive for COVID immediately after delivery. But we have to remember that immediately after delivery, these babies have a mixture of both maternal blood and their own blood system. So if mommy was positive for COVID initially after giving birth, it's more likely the baby will also turn out to be positive as well. And so that out over time should wane in terms of the neonate should start building up their own immune system, and those antibodies should clear out. But in terms of breastfeeding, I wholeheartedly agree with the American Society of Reproductive Medicine that says you should breastfeed, and so does ACOG SMFM.
The other comment that I've heard in several places is that if you are actively positive, symptomatic with COVID, you can, while you're breastfeeding, wear a mask and continue to practice really good hand hygiene so that your chances of passing to baby is less.
Dr. Santos, a few people are asking what the side effects are for pregnant women. I'm assuming they're the same, whether you are pregnant or not, your risk of getting the side effects. But for you personally, how was it for you after you received your first shot?
Yeah, so good question. The side effects are the same, no different that we are aware of at this time. My first vaccine actually went really well. I did have some arm soreness. The first day kind of felt a little achy, but by the second day, I was totally back to normal and felt fine. I anticipate after my second dose that I may feel a little bit worse. People in general are having a higher frequency of having side effects after the second dose. So I may, need to take some Tylenol if I'm feeling feverish or more achy, but in general, most people have said within a day or two after having either dose of the vaccine, they're feeling back to normal.
Thank you. Dr. Francois, for you, when I was younger, I always thought, okay, well, when I want to have a baby, easy peasy, it's easy to get pregnant. And I think I'm one of many women who have faced challenges when they were trying to get pregnant. And so my kids are now older, 12 and 13. So I was like, sign me up for the vaccine. I have no worries. But before my oldest was born, anything and everything scared the heck out of me. I did have to go see a maternal fetal medicine specialist. And so for a lot of women who are having a harder time conceiving, they have an even more heightened fear. And their concerns seem to be even more intense. So for women who are thinking of or are undergoing fertility treatments, what is the recommendation for them when it comes to receiving the vaccine? Should they put it on hold, get the vaccine, and then start up again? Or what is some advice you can give to that population?
So thus far, we know that the vaccine does not interfere with fertility in either men or women. And so your fertility is not going to decrease or worsen in the case of women who are struggling with infertility. The American Society for Reproductive Medicine states that women who are contemplating pregnancy, women who are pregnant, should get the vaccine. And this is a society of reproductive endocrinologists who are the specialists in the area of reproduction and infertility. And if for that society to make that statement quite clear that there should not be a hesitancy by women to get it, whether it's preconception or during conception or after conception. Therefore, I feel comfortable saying, yes, they should proceed with getting the vaccine. Once again, a shared decision with your healthcare provider, whoever that may be. You have to have an honest conversation, a counseling session to see if you would benefit from it. And weighing that benefit and risk ratio for your life and for your family.
A question that came into Facebook: is it better to wait to get pregnant until you receive the vaccine?
Thus far, there's no data. There's a lack of data on safety, but there's no set timeline in terms of when to get the vaccine. The only stipulation about the vaccine in pregnancy is this: we know that typically in pregnancy you get several vaccines. You get the flu vaccine, you get your tetanus, diphtheria, and pertussis booster. The only caveat, the only recommendation is that you should wait 14 days between these two vaccines. So if you're going to get your COVID vaccine, you have to wait 14 days before you receive your Tdap or your flu vaccine. And that was the only time frame that I can find in my research in terms of preparation for discussing with my patients and in the literature. There's really no other set time frames in terms of when you should get the vaccine, in which trimester you should get the vaccine, or in which part of the infertility or in vitro fertilization cycle you should receive the vaccine. I said overall, if you're committed to getting the vaccine, because we know overall the risk is small, you should get it as soon as you possibly can and have a shared decision with your family and your healthcare provider. But I would believe the sooner the better instead of waiting, because in the process of trying to conceive, you become infected with COVID-19, right? For instance, it sets back your cycle, right? And so your cycles are timed, and those cycles are timed for a reason. And so anything that might interfere with that cycle time, and let's just say we are women that are a little bit more mature and wiser than wisdom, I won't say the age. How so? We don't have that much time to kind of wait for a setback, if that kind of makes sense. So those things you just wait. You wait for yourself. But, overall, I believe that all our society says that that the safety of the vaccine is probably there in terms of it's safe to use.
And opening up this one up to the group, someone had commented that they had heard anecdotally that the vaccine has affected women's menstrual cycles. Is there any grounds to that statement?
As a gynecologist, I've never heard of that.
Okay. Something for Drs. Brandley or Santos. Can I get COVID-19 from the COVID-19 vaccine?
No, just no. No. You cannot. It is an inactive mRNA messenger. What the comparison we use, it's like an email. It's an email that tells your body how to make this protein. This protein, then you have antibodies that are made from the protein. So no, you can't get the virus from the vaccine. It's really unlikely that mRNA is even going to leave your shoulder. Like, it's not going to get anywhere else in your body.
The other question too, I hate to even bring it up, but the question people always ask is, are you sure there's not some kind of tracking device or microchip in that vaccine?
I don't even know how to answer that question at this point. I'm going to say no. I'm sure that there is not. I'm sure that the cell phone I carry around has more information on me than the vaccine.
I was going to say the only way to be completely off the grid is to get rid of these.
Yes, that's your tracking device right there.
Right? Yeah.
I also want to add this, Zara. I want people to think about this for a second. Who are the people who are being vaccinated first? Let's just stop. Let's just, as a society, let's stop and think about this. Who are the people who are being vaccinated first? It's healthcare workers. Mm-hmm. What does society put at risk? The frontline workers who can protect and care for the society, the people of a society, and kind of expose them to this increased risk. Because if we go down, who's going to take care of you? And that's the way I always tell my family members. I took it. So if I go down, who's going to take care of you? So therefore, that conspiracy theory in terms of there's something wrong, they're doing, tracking, whatever it may be. I just try to bring it back to your basic, life. Society needs doctors, nurses, ER techs, EMT, all of us to kind of keep the society healthy. And if we go down, who's going to do that? And so when I think of it that way, and I tell my family that way, they seem to kind of get it. So I will share that with the Facebook audience. Just think about it in that sense. And then everything else, all the other conspiracy theories will kind of wash away when you think of it from that perspective.
No, that's a great point, because the other big group that they're trying to vaccinate now are 65 plus, people like our parents and our grandparents. I mean, they want to track my dad going to Costco and taking a walk to the park, go for it. But yeah, so I just wanted to get that out there, because we always get asked this all the time. Are there microchips in there? Is it injecting me with COVID-19? The other question that just came in, and this was a hot topic, especially maybe third quarter last year, fall of last year. Do the vaccines contain fetal cells? You are all shaking your heads no.
No.
There you go.
Sometimes we forget. Yeah, so no. Thus far, no, in terms of the way the vaccines were produced.
Okay, and I'm looking through the questions here. Is there any timeline on when pregnant women and children will start to be part of the COVID vaccine trials? And when can we expect more research for those groups?
In terms of pregnant women, I know that they are trying to actively recruit now. I think that data probably won't be available to sometime in the near future. We hope, but they are actively trying to recruit at this point for pregnancy.
In terms of children, the last thing that I have seen lately has been gradually decreasing the age for who's potentially volunteering to be vaccinated. And so I think it'll be some time before we get down to, young children or babies getting vaccinated. They are actively recruiting breastfeeding mothers at this point for studies to do breast milk studies to see what kind of antibodies actually are being produced. So keep your eyes out there if you're a breastfeeding mom and you get your vaccine.
I know that would.
My vaccine, I was just going to say that I was able to enroll in an ongoing study for pregnant women and the vaccines. I think it was via the University of Washington. So I just signed my consent form. So hopefully we'll have more information from them soon.
And just for those of you who are watching at home right now, the Pfizer vaccine is only approved for 16 and up, Mrna for 18 years old and up. And both companies were either about to start or have already started trials in the 12 to whatever their lowest age bracket is approved right now. But as of right now, I don't think there are any clinical trials planned for anyone younger than 12 is what I have heard. Okay. All right. So someone is asking, I have a cyst on my ovary. Can the vaccine have any negative effect on this?
Probably not. Well, I'm going to say no. The vaccine won't have any effect on your ovarian cysts.
Something that struck me in your presentation, Dr. Francois. So I'm the only non-MD here. I went to journalism school, so far away from the education you all had. But something that struck me was you said there isn't a whole lot of research and data when it comes to safety in pregnant women, but there is also not any data that shows severe and serious adverse effects. To your point, do you think, Dr. Francois, and the other doctors too, do you think that we've just become a society where we tend to focus on the negative instead of, you know what, but there is no research. There's a very, very small percentage of people who have very serious side effects to this.
I think it's always the fear of the unknown,
Mm-hmm.
right? And so I think we heighten those fears and expect the worst, but really I think having to flip the script, and we haven't seen any severe complications yet. Animal data don't suggest that there's going to be any complications. And so I'm kind of looking, I think Dr. Francois said it, half glass full rather than half empty.
Mm-hmm.
And then hopefully we'll have more information to come.
Yes, Dr. Brandley.
The other comment I would just make is that we have spent a lot of time with this vaccine talking about potential side effects and risks and things like that. We haven't talked a lot about what a fantastic potential that this has. I mean, you don't see vaccines with numbers that have 95% efficacy rates. And like I kind of was mentioning before, we've all been living in this pandemic for a long time and living in kind of social isolation and all of this stuff. There's a lot of potential win here. As much as we talk about the potential for risk and everything else, there is a huge amount of potential win here. So I hope that we can start to kind of flip the script and talk about the good as well.
And on the horizon is the Johnson & Johnson vaccine. So, which is your more traditional vaccine. Right?
One dose, right?
One dose,
and
mm-hmm. It's actually the protein, the attenuated protein that we're used to getting, right? So that's the type of vaccine that we're accustomed to. And so I know eventually the hesitation with vaccine will start to dwindle down. But you're right, I truly believe that the majority of things that we do in pregnancy, there is the care, you know, your maternal instinct kicks in. You're trying to protect your baby, right? And your baby from whatever potential harm. And I always tell my patients, we have to look at it this way. We would not proactively ask you to do something that could potentially harm your baby. The knowledge that we do have is enough to tell us that, yes, this vaccine is relatively safe. The risks are there, but the risks are there for anything that we do in pregnancy. You take a Tylenol. Ask me what's the Tylenol risk in pregnancy, and the litany of bliss will come up. But people never focus on that because we take Tylenol every day, and Tylenol you never look to see, oh, what can Tylenol cause? Well, there are risks associated with Tylenol in pregnancy, but we don't discuss them because we just look at the upshot. So I say, just look at the upshot for now. Okay. And then as the data comes in, then we can backtrack on some of it or kind of report it. And then you can kind of decide for yourself from there. In the meantime, COVID, illness, and pregnancy is serious. It's very serious.
Something Dr. Niall Mason, he's our medical director of pediatric infectious disease. He did our last virtual health series on COVID-19 and the vaccine. This was about a month and a half ago. And he said, instead of looking at it like, holy smokes, why would I use a vaccine that they developed and released within a year? He said, look at it like this. It was developed so quickly by a conglomerate of scientists from around the world. And the reason it was developed so quickly isn't, the technology itself wasn't new, but it's because we got rid of the red tape. We got rid of the red tape that normally holds up other vaccines. And he said, instead of thinking, EEP, I don't want to get a vaccine that they just started working on a year ago. It's like, wow, look at the amazing work all of these scientists and experts did, governments lifting red tape to get this in your arms. And so that's another, it's a great reminder, just like what you were all saying, it's kind of time to shift the thinking instead of being negative Nellies all the time. A question that did just come in on Facebook: are the antibodies a baby receives in utero different than the antibodies it receives from breastfeeding?
So yeah, they can be. So there's two different kinds of antibodies that usually we talk about. We talk about IgG and we talk about IgA. IgG antibodies tend to be the longer term ones that get passed, kind of crossed through the placenta when you're pregnant. And then IgA antibodies are the ones that are secreted in the breast milk and then taken by the baby through breastfeeding. Both of them can be effective in helping. We call it passive immunity when a baby is getting these antibodies. It means they didn't actually make the antibodies themselves. They weren't exposed themselves, but they're passively getting those antibodies from mom. Looking at just a couple studies, I don't know, Dr. Francois, if you've seen a little bit more, we have seen that moms who have been infected with COVID are having some passive immunity passing through to their neonates when they're just born. And now we're looking at studies to see if we actually have good amounts of antibodies in the breast milk.
There's still just case reports, and so, but Dr. Brandley summarized it excellent. That was a great summary of the type of antibodies that we can predict. Once again, still more to come. We just have to wait. There is, like I said, there are some case reports where there is an utero infection and there's seeding into the placenta. But what does that ultimately mean? We don't know, because there's just not enough data there as well.
Okay, another question. Aside from having an allergy to one of the ingredients of either the Pfizer or Moderna vaccines, are there any other people who should not receive the COVID-19 vaccine?
I don't believe so. I think the caveat is if you don't have an allergy to the components of the vaccine, you should be able to. There's a list of questions that the CDC has published that each the person who's administering the vaccine has to go through. And among those lists, even if they say yes to one, they still are a candidate for the vaccine. So I can't think of anything. Can you guys, in regards to who cannot be vaccinated?
I can't think of anything apart from the anaphylaxis. Recalling the questions that they asked, I took my mom to get vaccinated, and one of the ones was she was on a blood thinner and she's actually had a heart attack. And even those things they're not disqualifying. They just wanted that information just to kind of be on record.
Well, I think part of that is too to try to help mitigate potential side effects with each of those questions. So my brother also on blood thinner, so holding pressure for longer. Someone that has had other allergies, but not to components in the vaccine. They're watching longer after vaccine administration to make sure that they do well. But I think outside of allergy to the known components of the vaccine, I don't think there's any true contraindication to getting it. Just some of those questions might play a role in what they do to try to make sure that you do well after the vaccine.
Okay, and Dr. Karen Dahl, she is one of our experts in this field. She just texted me with another answer. She just said, everybody's absolutely right. So the only reason you are not to get the vaccine is if A, you are too young, B, as Dr. Francois mentioned, if you got a different vaccine within 2 weeks of this one, or 3, as everyone mentioned also, if you have an allergy to one of the components in the Pfizer or Moderna vaccines. So great. See, this is good. Thanks, Dr. Dahl. Hi. Okay, so let's see. A message that just came in on Facebook. When it said that the vaccine doesn't contain fetal cells, does this mean that the vaccine can't cause abnormalities for the baby? I think the real question this person is probably asking is, what are the risks of any potential side effects to the baby? In this case, like Dr. Santos received it while she's pregnant. Are there any potential side effects to the baby?
Thus far, there are no reported effects to the baby. Toxicology reports in animal studies showed no adverse effects to the cells of the fetus. Therefore, it doesn't matter which trimester you get vaccinated. I think if there was a potential for harm to the fetus, and I counsel my patient always, if you ever have any hesitation, get out of your first trimester, right? So organogenesis, or the baby forms within the first 8 to 10 weeks of pregnancy. If there's ever any doubt, you just wait a little bit, right? So you wait until you kind of clear that first trimester hurdle. And in the second, third trimester, the baby's just, at this point, there's growth and there's development, but there's not formation, if that makes sense. So we formed our baby early, and afterwards the baby has to develop those organs and grow those organs. And so if there's any hit to the cell, to the layer of the cell, at the cellular level, that hit will take place relatively in the first trimester. Thus far, we don't see any adverse effect to fetal cells, but once again, data is lacking. So if there is a hesitation and you're in your first trimester, then wait until and receive it in your second trimester.
There is somebody who sent us a message on, oh yes, sorry, Dr. Santos.
And I think going back to the way the vaccine works too is really important to speak to that. Knowing that the mRNA does not go into the nucleus of the cell, so it does not go into the genetic material, is also really important. So that was reassuring to me. Despite that, I did wait for my first trimester to end, and then I immediately got it. But I think it's probably safe to do it during the first trimester as well.
And that is something that our physicians, not just you three, but our other physicians have also stated. This does not alter your DNA. This is not how this works. So to your point, Dr. Santos, yeah, you waited because you had some hesitancy, but I mean, if you had to get it in your first trimester, you think, I mean, would you have?
Yeah, if there was, some sort of limitation that you have to get it now or never, I 100% would have gotten it.
Mm-hmm.
I have the luxury of working at an institution that, was more flexible as far as scheduling goes to get my vaccination. And so I was able to get it the week my first trimester ended. But otherwise, I would have gotten it whenever I could have.
Okay, so here, oh yes, sorry, Dr. Brandley.
Comment that we've talked a little bit about this prior, but there is real risk to the baby potentially with getting a severe COVID infection, right? So I was pregnant and we didn't have a vaccine available the entire time I was pregnant. I was terrified to kind of go into work and be exposed and potentially end up having, preterm delivery because I was really infected and sick. I was really in a good position where I had a group that was very protective of me and my baby. But there is real risk to delivering early, to delivering with mom on a ventilator, to all of these things. So that risk is pretty high compared to the vaccine.
A question for the group. If I receive my vaccine, both doses, does that mean I don't have to practice social distancing, wear mask, all of that good stuff?
No. Can we say no?
Yeah.
So yes, you must continue social distancing and masking. We still have to get to a point where there's 70% is what the number that I keep hearing, in order for us to be able to have quote unquote herd immunity. And we won't be able to achieve that for a while. And so I anticipate that we're going to be masking and social distancing for a longer period of time than initially thought. I believe for me personally, when I got the vaccine, you guys can share, Dr. Santos and Dr. Brandley, your experience. What I felt when I took the vaccine, because of my constant exposure, it was that I could take a big, deep breath and just let it out. Because now I felt I wasn't putting my family at greater risk, if that makes sense. Because now I came home, I'm still doing the same thing that I did prior. I'm removing my robes. I'm immediately taking a shower. Then I will greet my family. But I feel now as though that I have some layer of protection where I won't risk that. I won't be at that increased risk to transmit it to pass it on to my husband and to my children.
Yeah, that still is my biggest fear, is coming home. I have a 4-month-old baby smiling at me, when I walk in the door. I was really lucky to get to be vaccinated before I came back from maternity leave. I'm so grateful. But I think what it comes down to is we're still going to practice really safe guidelines. We're still going to do everything that we've been doing, but that doesn't mean there's no point in getting a vaccine. That's a lot of what I've heard has been, well, if I still have to do all this stuff, what's the point of me getting the vaccine? We'll hit a threshold. At some point, we can hit a threshold of this herd immunity, or that it's safer so that we can resume back to kind of more set of normalcy. Mm-hmm. And in the meantime, the frontline workers can come to work without so much fear of actually bringing it home to the rest of the family.
Mm-hmm. Although there's still some debate, which I've had trouble trying to find the answer to. This is my question now. So if you get the vaccine, can you still contract it and spread it to somebody else? I know the vaccine will protect you from serious effects of COVID-19. I think Mrna, I read, it's like 100% against any serious case of COVID-19. But can you still transmit it to someone else? Do you know of any studies that show whether you can still be a carrier even if you're vaccinated?
So we don't know. Mm-hmm. I mean, that's another big question that everybody really wants to know the answer to, if you can still have an asymptomatic infection and still spread it. And the reality is we don't know, because it's a really hard study to kind of create, because who's getting tested? The people who have symptoms. People who don't have symptoms aren't getting tested. We don't know if they're spreading or not. So is it likely that you're much less likely to have an asymptomatic infection and pass? Yes, it's less likely, but we don't have the data behind that to know for sure.
Okay, no, thank you for answering my question. I like wearing masks out in public. I like social distancing, and this is the healthiest my kids have been for winter, and I can't tell you how long. So it's been great. Something that another person has asked us through social media is, if you get sick with COVID-19, so not the vaccine, but the actual virus, if you get sick with COVID-19, could that impact future fertility? Oh, Dr. Francois.
I was trying to unmute.
There you go.
So no, it doesn't appear. It doesn't appear to affect future pregnancy or future fertility. Okay. It doesn't appear to affect fertility, period. So we're going to just put that out there. Okay. Doesn't seem to affect fertility.
All right, thank you. The recent WHO statement, this is another question that came in. The World Health Organization said that they're not recommending certain pregnant women to get the Mrna vaccine, but the CDC does. With conflicting information from trusted sources, who do we trust in the end? Dr. Francois, I think this is for you.
So that's a great question. But just recently, the World Health Organization backtracked on that statement. The New York Times reported it. I didn't read the article in depth. But I have a tendency to follow our CDC guidelines, what our Center for Disease Control and Infection states for the United States of America, and what our society guideline states. And so I will go with that first, unless otherwise stated. But I do believe that the World Health Organization did, I don't know if it was retraction or kind of made it a little less
clarification.
Stronger statement that came out in the New York Times article. But I haven't seen it personally. I just kind of took a glimpse at it prior, and I think I saw that alert come across.
Okay. One question that came in just now: if you've already had COVID during your pregnancy, do you recommend still receiving the vaccine if you are still pregnant?
90 days. 90 days after your COVID infection, you go get your vaccine, and you should go. So yes, I try to tell patients that we follow the same guidelines that we would in a non-pregnant state. And so in a non-pregnant state, if you have had the COVID infection, the recommendation is you wait 90 days prior to receiving the vaccine. So I would say the same thing. If 90 days that you're still find yourself pregnant, and you're still pregnant, then yes, you should be able to receive the vaccine.
Okay, and it looks like Dr. Dahl just commented, Dr. Francois, that the World Health Organization did fall into alignment with the CDC now. So yes, if you are pregnant and you become eligible to receive the vaccine, their statement is now you should not be denied the opportunity to receive the vaccine. Okay, so great to know. I love having 4 doctors on call right now for this. This is great. We are approaching time. I do want to remind people who are watching at home, continue to leave your comments and questions there. If we can't get to your questions right now, we'll circle back with these doctors and post those in the comments. Before we leave though, I did want to ask all of you to make kind of sort of a closing statement, if you will, and just share your thoughts, especially because some people might have just been tuning in the last 20 minutes and might have missed the beginning. Why don't we start with you, Dr. Santos, about why you, pregnant, 15 weeks, why it was important for you to get the vaccine and what you would want to say to people who are still unsure, which is understandable.
Yeah, no, totally understandable. I think you have to do what's right for you and what's going to allow you to sleep at night. But for me, it was really about protecting myself, protecting my baby, protecting my patients, my community, and then, reflecting back on how does the vaccine work? It does not, affect our genetic material. All known information that we have makes it appear to be safe. And then knowing that infection with COVID-19 during pregnancy is a risk factor for having severe disease, being in ICU, being on a ventilator, having preterm birth. So all of those factors are really what helped me make my decision. And I feel really comfortable and happy with that.
Thank you, Dr. Santos. Dr. Brandley.
So again, my number one priority is protecting my new baby and utilizing this wonderful breastfeeding that I've been doing, and getting vaccinated was just the most important thing to me so that I can pass on those antibodies to this little girl. And then also so that we can start moving towards getting our lives back, getting our communities back, getting our village to help me raise this baby, getting everything kind of back in line. That was the most important part to me.
Thank you, Dr. Brandley. And then Dr. Francois, you're like my idol because you're always so calm and put together. And I know you have like 1 million kids at home and you're juggling a family, and just so I really appreciate you taking the time to speak with us. What are some closing thoughts you have for those folks who are watching at home right now?
I think the most important thing I can leave the audience with is that vaccination is available in pregnancy. You should consult with your healthcare provider and make a shared decision based on your own risk, based on your risk for the severity of the illness of COVID, and based on your community transmission risk. Don't allow scare tactics and fear to guide your decision. Allow the information that we do have and the information that we're going to continue to gather in order for you to make an informed decision. But pregnant patients should not be excluded from vaccinations if they so desire.
Thank you again, doctors, all 3 of you. And Dr. Dahl, watching on her computer, appreciate all of your time. And again, for those of you watching at home, Valley Children's has a plethora of COVID-19 material and resources for you and your families to look at. You can go to our website, valleychildrens.org. We have an entire COVID-19 information hub. It also includes lists to low-cost and no-cost testing centers. We have some vaccine information. Right now, though, we are still in the first tier of distribution. So it's healthcare workers, certain healthcare workers who are eligible for the vaccine right now, along with 65 plus. That is the tier, but they should be opening up to 1B soon in some areas, dependent on when shipments are coming in. So check in with your county health departments. We would love it if Valley Children's could offer the vaccine to anybody and everybody who wanted it. But right now we are really at the mercy of county health departments for their allocations. And so you really have to talk to them because Valley Children's is not a COVID-19 community testing or vaccine distribution site. So again, go to valleychildrens.org/COVID19 for online information and resources. And then during business hours during the week, we have nurses who are answering calls at our COVID-19 hotline. Any question you have, literally, they are there to find the information. If they don't know it, they will help you find it, or they will say, you know what, we don't have information just yet on that. But the number to call if you are in the 559 is 353-3333. The toll-free number is 888-286-9336. This video in its entirety will be posted on all Valley Children's social media channels later today. So please feel free to share this with your friends or to rewatch it if you missed part of this. But again, thank you, Doctors Francois, Santos, and Brandley for your time. And we appreciate all of your advice and your very comforting words as well. Thank you. Have a good day, everybody.